All the things with Lane and Laney. Husband and wife, parents, living in the Midwest. Every show is different, and almost no topic is off limits. Please help us out. Subscribe to the podcast. Download the show, not just listen. Rate us. That 5-star rating would be amazing. Give us a review and tell a friend. Help us spread the word. All the things. Here's Lane and Laney.
All right, welcome everybody to All the Things with Lane and Laney. We've kind of been on a hiatus here from, I would say, 2 or 3 weeks. But once summer hits, it's just...
life is a little crazy.
Crazy balls. I mean, logistics of kids, as I was just explaining, children, trying to get them running around 2 or 3 days out of the week. I can officially now work probably 2 days, maybe 3 days out of the week, and she's got all weekend long and all Monday and all the rest of the week. Yeah. But we are back and bringing you hopefully some decent, entertaining thoughts and ideas. But today we have Dr. Wade Banker, and he is an expert in testosterone replacement therapy, TRT, a subject that I've been eager to explore for a number of years. And we're going to talk about all the things testosterone and benefits and or risks for the aging man. So please welcome to the podcast, Dr. Wade Banker.
Thank you. Thank you very much.
Yeah, thanks for coming on.
Yeah,
My pleasure.
Good. So where are you located?
So our office is in Maumee at 1500 Holland Road.
Okay.
Right at the corner of basically Holland and Dussel.
And that's Lux Laser?
That's Lux Laser.
Okay,
yes.
So you guys do a bunch of different things there.
Oh, yeah. Yeah, I mean, the hormone replacement is just a fraction of kind of what we do there. We do a lot of cosmetic things, ranging from Botox and Juvederm to tummy tucks and breast augmentations. So, and everywhere in between.
I say you must, not to get too personal about anything, but people probably get pretty populated in there, pretty busy. You guys are busy?
Oh, yes.
Yeah.
We're very, very busy. And we're booked out for months ahead of time.
Interesting.
Oh, man, I better get on my appointment then.
It does take a little while to find some time there now.
Yeah. I was going to say, it was after one of our podcasts with somebody else that I got interested in Botox. I was never going to do it, but after talking to her and realizing it was pretty safe and all of that, Lane bought me a gift card to Lux Laser for some Botox. So Dr. Wade reminded me.
Keeps everybody looking young.
Yes.
I say we don't know.
I'm just trying to get rid of this.
Yeah.
What the fuck line I have right in the middle of my forehead.
It screams your thought every time it pops up.
Yeah, pretty much.
But no, on the subject of TRT, who should be on TRT, and when or why does it become a concern that people begin to supplement it?
Okay, big question. But who should be on TRT? Well, kind of start there. And really, anyone who is starting to feel like they want to be more like they used to be. So a lot of guys come in here, a lot of women, same thing. So, I just don't have it anymore. I work all day. I'm so tired. The kids are at home. I can't play with them. I'm just not the guy I used to be. And that's like the key phrase. I'm not the guy I used to be, or I'm not the girl I used to be. And, and they're starting to feel the signs of aging where they're more tired, they're more fatigued. A big one is libido. Their libido starts to go down, and that can cause some interpersonal relationship problems.
Sure.
Yeah.
And the same applies for women, where they're gaining weight and they're working out hard and they're dieting, but they're just not getting anywhere. Those are all signs of your hormones not keeping up with you.
Okay. That was going to be one of my other questions was, do women take it? Is there like a supplement that women take that's comparable to the same feelings and or whatever that men get?
Biologically, men and women are identical. They have, different organs than we do, but, on a cellular level, we're exactly the same. We both make testosterone, we both make estrogen, so they feel the same exact thing we do when they, start to deplete their levels as well.
Okay.
Huh. I didn't know that.
I didn't know if that was more of a estrogen injection,
right?
Or
and that's the thing that people don't understand is they think, oh, women are estrogen and men are just testosterone.
Right.
That is not the case at all. We are both the same. So when you raise a woman's testosterone level, they feel just as good as a guy does when they get theirs raised.
Interesting.
So to your point, we might do more women than men, actually.
Oh, really?
At our
Really?
place, yes.
Now that doesn't come with any of the side effects that everyone's thinking. Okay, she's going to get a huge neck. She's going to get bulging
bulky.
biceps. She's going to get bulky.
Yeah.
She's going to get your testicles or something crazy
Hair.
like that.
Hair in places you don't
Right.
want it.
The only way you can get any of those secondary things happening is if you run them way too high, which we don't do.
Okay.
Same with guys. They're going to get, you run a guy way, too high in the 2,000 or 3,000 levels, and they're going to have problems. So you keep them all within a physiologic range of what their normal range is.
And that's strongly dependent upon age, right?
For the most part, yes. But really all of our levels are, if you look at, a 25-year-old kid and a 45-year-old man, they're not that much different really, in terms of what the range is on a low level and a high level. They're pretty much the same. It's just that when I test a 45-year-old man, I know he's going to be lower than that 25-year-old.
But we're just talking like small
Yeah, we're talking
increments.
Yeah, smaller increments, and so, it can be bigger in some, but I see a couple of patients of mine are in their 20s with low T and symptomatic. So that it can happen in anyone at any age, but by and large, it's 40 and over.
That's crazy to me to think that the 20-year-old me that was just walking around hard on with just tons of energy and could go all night and run around and drink and all that stuff. It's not the same person I am today.
Right.
But the testosterone levels would be just about the same, only maybe a step down.
They're probably lower for sure. In average, you lose about 1% per year. So talking about a few years, and then that comes down.
Right.
So it depends on kind of where you started.
Okay. Well, one of my other questions was what complements testosterone replacement therapy the best? Is it diet? Is it exercise? Is it both? Is it sleep? Is it rest?
Well, it is all of those things, really.
Yeah.
If you're not sleeping well, nothing makes you feel better.
Okay.
That's the first thing. So if you're a poor sleeper, you can have all the testosterone in the world and you're going to feel terrible the next day. So you have to be able to sleep well. So that's very key.
Okay.
And what I see is with giving the testosterone to people is that they do sleep a lot better. So that's one big advantage. Diet and exercise, of course, that kind of goes along with everything, for good health. The more you exercise, the better you're going to feel the effects of it.
Sure.
Okay.
So the more active you are, the better you will be.
Okay. I think sleep has a lot to do with our life.
Well, yeah, we stay up way too late and then get up early.
Well, if we didn't do that, our lives would be get up at 6:30ish, sometimes earlier than that for you because
Yeah.
you do your bar class, and then we'd get up, drive hard through our day, get a workout in, and then go to bed at 9 o'clock, about half an hour after the kids go to bed. And that would be day in and day out. I just feel like we need to
We need that
wind down.
downtime, so that's why we end up staying up too late.
Yeah.
So
Yeah, and then when you're getting up early, you have to get that sleep in.
Yeah.
Everything, the whole world is a lot better when you're sleeping well.
that's true.
Absolutely.
Yeah.
And you don't treat people like they are the reason for your more miserable existence. So what are the benefits when somebody comes to you and they say, I just don't feel the way I should. I'm this, that, and the other. What do you sell them on or explain to them they're going to have?
Well, when I have someone in as a consultant, I see them first. We go over a big questionnaire and has a lot of different symptoms on it. The big ones being libido. How's your libido? How was it? How was it when you were 25 and how are you now?
Yeah.
So usually it's a big change between those two. And if it's not, then they're probably doing pretty well. Energy, fatigue, those are really big ones. And so those are the things that when we start someone on TRT, those are the things I expect to get, easily 80-90% better.
Really? Okay. And how long does that usually take? Is that like a month out? Is that a
Couple weeks.
Okay.
Couple weeks. It's pretty quick.
Okay. And what are the downsides?
So the downside is that there's a cost to everything. So there's, a cost associated with it. There are labs that we have to get on, somewhat of a routine basis. So we have to do labs now and then, and, we'll check levels and make sure, everybody's healthy. So we'll check a number of different, labs every time. Make sure the prostate's good. We do a little bit more than just the TRT. I don't just check your testosterone and estrogen levels.
Okay.
We check a whole bunch of other levels. So we'll uncover some other issues, people with low thyroids and, prostate issues and things like that. So we'll uncover some other issues that needed to be addressed.
Okay.
So if you start this, is it something that you're going to just have to keep doing then for the rest of your life, or?
You don't have to do it for the rest of your life, but you'll probably want to do it for the rest of your life. So there's, when we start someone on the hormones, they'll get a lot better. And then at some point they say, I feel really good. I'm just going to stop. Well, then when those levels come back down, it'll hit them pretty hard.
Yeah.
Yeah, because it comes down fast.
Okay.
And so, it takes years to get, people say like over the last 10 years, I'm getting less energy, more fatigue. It takes years and years for that to build up.
Right.
When those levels come down, they come down in a matter of a week or two.
Right.
Oh,
So
wow.
they'll go from, to 100 to 0 within a couple weeks.
Okay. So is that from your body, just the receptors in your body just kind of stop receiving, or does your body stop producing because it's getting this supplementation in?
Your body would stop producing, but we usually give something to keep your body producing its own testosterone.
Okay.
So you'll still make, if you're at 300, you'll still make your 300.
Okay.
But, we're taking you, up to the higher normal ranges like 800, something like that.
Wow.
So you'll go from 800 right back down to 300 pretty quickly, and you will know the difference between the two.
Yeah.
I bet you would.
Yeah.
Yeah, I have a couple of friends that either have taken it or are on it, and they're all over the board. And one of them I know was getting it from a facility, aka a doctor, and it was all prescribed. And I said, well, what about your testicular shrinkage? What about your gynecomastia, your woman boobs, your man boobs, whatever that will, be one of the drawbacks. He says, I don't get that because they supplement this other thing into it.
Correct.
I'm like, okay. So that's the difference between some guy that's ordering supplements offline and just kind of picking, well, this looks good. That guy looks jacked. I want to look like him, so I'm going to order this.
Right.
Whatever
That's
the hell
the
it is.
thought, right? Oh, I want to look like that guy. Well, that guy is probably doing a couple of other things, to keep those secondary problems from happening.
Okay. Yeah, I didn't know if that was a doctor prescribed thing, or if that was just like if you get this certain type of steroid and or testosterone booster that it's automatically got this in it, so you don't get any of the side effects.
And most doctors who don't specialize in this, and we specialize in it, but most doctors don't understand that there are other things that you have to do. They just write a script for testosterone and see you later. Your estrogens could be off the board. Your testicular shrinkage might start happening, and once it starts happening, it's hard to get back. Right. So you want to start right. There are some things you give. I like to give HCG along with the testosterone, which goes into it's a little shot that you give yourself a couple times a week. And that's what keeps you producing your own testosterone and keeps your sperm counts up too.
Okay.
HCG is used for fertility purposes as well.
Okay.
Oh, I was always thinking that was like a weight loss thing.
Well, there is a weight loss thing with that too.
Okay.
Yeah, given it certain amounts every day, then it can be used for weight loss.
Okay.
But that's not why we use it.
Okay, so it just has other purposes.
Okay.
What about risks? Because I know, as a woman who's probably premenopausal, they talk about what?
Possible thyroid issues.
But I mean, they always used to do hormone replacement therapy in women, and now it's kind of gone by the wayside as far as I know, that they don't, because of all the risks and things.
Well, there really is. If you're doing it right and putting people in the right levels, the risk is very, very low.
Okay.
I mean, it is, risk with, they used to think it might increase breast cancer if you're giving someone estrogen. It does not increase the risk of breast cancer. Okay. If you're an ovarian cancer or uterine cancer, it does not increase the incidence of that either.
Okay.
So the risk of those kinds of things are very, very low,
Okay.
if existent at all. And if you're keeping people in the right ranges, then there's almost no risk.
Okay. Let's say, like, I was getting back to my buddies because I'm living vicariously through them. Let them be the lab rats, let them try everything out.
But it has to be done right. That's
Right.
the thing. There is risk if you're running too high or you're doing too many things or you're, putting in Deca with it or something, some of the horse-derived steroids,
Okay.
But we don't do that. You keep people at a good, healthy level and they perform better. That's just the way it is.
Okay. So what, all in, I mean, obviously everybody's different, but say you got a 45-year-old male that comes in and says, all the things you just talked about, and you start putting him on said program, how many shots and or pills is he taking or per week?
Okay.
What's the regimen?
So there's two different ways that we can do this. One is with testosterone pellets, and the other one is with the liquid testosterone, which is the shots to give themselves.
Okay. I've heard a lot about the pellets. I can't wait to hear more about the pellets.
The pellets is actually the best way to go.
Is it?
It
Okay.
It is the best way to go. It's an injection that I would give you once every 4 months. For women, it's once every 3 months.
Okay.
And it keeps your body at a very steady state level of testosterone. So for 24 hours a day, 7 days a week, you are almost at the exact same number all day, all night.
Nice steady bleed out.
Yeah, and that is beneficial because the body responds better to normalized levels.
Okay.
So by far, the pellets is probably the best way to go. Now, there's some drawbacks to the pellets. It's a pretty big shot, right? I mean, it's not a tiny one.
So you probably couldn't do it then.
Oh, give me a break.
Well, we do lidocaine. You won't even feel the shot because I usually put a little bit of lidocaine in, and we put the pellets in that way. But it's a little sore for a couple of days.
Okay.
But that's about it.
So just to be clear, the pellets are like a thing that you put underneath the tissue, and they just
Into the fat.
Into the fat of
Yes.
like say your butt.
Yes.
Okay.
Upper outer buttocks for the most part.
Okay, and they're just little tiny balls.
Look like Tic Tacs.
Tic Tacs that just leach out testosterone over time.
Correct.
Okay.
And yeah, the men usually last about 4 months, and the women's are about 3 months. The women obviously get a lot less than we do. It's a fraction of what we get.
Okay.
Okay.
So the women's shots are actually very tiny. So they don't. It doesn't bother them at all. Men, we take a few. We take more pellets, so that's why it's a little bit sore for a couple of days.
Okay.
And just because you're men.
And we're
handle
bigger
it.
babies. Right, we are bigger babies. Now, with the liquid testosterone, that is, I like to do that. A lot of guys you'll see out there do like once a week shots into the muscle.
Okay.
Some guys do once every 2 weeks shots into the muscle. The problem with that is, and going back to that steady state level,
Yeah, it's a spike.
you could imagine that you take one big shot into the muscle, which hurts, okay, because muscle hurts when you put a big needle into it. You get a big spike for the first 2 or 3 days and everybody feels great.
Right.
But then for the next week and a half, they feel terrible because the half-life has already been through 2 half-lives.
Okay.
Wow.
So that's the worst way to do it. The best way to do it would be take a little bit every day, but that's kind of not fun, taking a shot every day either.
Right.
So kind of settled on 3 days a week. These are really tiny needles. I think they're a centimeter long, and they're like little insulin syringes. So give your shot 3 times a week, and with the HCG in it, and that keeps a fairly steady state level. Not as good as pellets, but it gives it as much of a steady state level as you can get.
Okay. Now, cost. What's the difference? How much would each one?
They're about the same.
Each one for about 3 months, it costs about the same as the pellets versus the injections.
Correct.
And the injections you're doing all yourself.
The injections you're doing all yourself. I usually show everybody how to do it, and it's really easy. Once you've done 2 or 3, everybody's an expert at giving yourself a shot. It's really easy.
So what is the cost usually associated? Because I'm guessing it's not covered by insurance.
No. Now, there are some, if you are really, really low levels, there are some insurances that will cover it. Now, we don't do any insurance at our place,
Okay.
but you can But a lot of those people, they don't prescribe the HCG. They don't.
Right.
They're doing it as kind of a, by the way, oh, here's some testosterone and see you later.
Okay.
You have to dive a little bit deeper. You have to get the HCG. You got to look at the numbers. You got to look at the estrogen, because someone might need an anastrozole, which is an estrogen blocker. It just depends on the person. But getting back to the cost is roughly going to be somewhere between $2,500 and $3,000 for an entire year, and that's pretty much with everything.
Not as hateful as I thought it might be. I mean,
Yeah.
for the benefits you're getting from that, it might be worth the payout.
Oh yeah, that's
So-
once you feel really good again and you feel like you did, trust me, you think
pay
that's
anything.
You pay anything for that.
Right.
Yeah.
It's like the fountain of youth brought back to you,
Right. I mean, I don't know if you can put a number on that.
Yeah,
actually.
right. I say there was something I was going to say about one or two of the other guys that I've known that have taken it or are taking it. They're taking just tiny micro doses, so they're probably talking the size that you're talking about, and they're trying to stay up around 1,000.
Yes, around 1,000 is a good number to be.
Okay.
Right around 1,000. Now, if you start getting over 1,000, 2, 3, those are the,
Bodybuilder.
yeah,
type.
those are. That's when you're going to run into problems. 1,000 is about the upper limit of normal. So I don't like to take anyone over 1,000.
Okay.
Even over 500 is pretty good.
Okay.
I'm happy if I can get someone over 500 or 550. They all feel a lot better. Now, if you start at 550, if you come in, we do your blood, and you have 550, I'm like, well, I can't really make you that much better. So, why don't we, wait, a little while, see if those numbers come down. But the one big misconception that I see a lot is you don't treat a number. So just because the number is there, a 400 to you might not be a 400 to me.
Okay.
So I'll get guys that come in who feel great. They feel like Superman, but they're below 500, but they're great. So
Yeah.
I'm not going to treat them. Other guys come in at 350, 500, and they have a hard time getting out of bed in the morning. And those people are worth treating to get their life back. So everybody's different.
Right.
Everybody's different.
Okay. I had a question, but I lost it. That's what happened. That's what happens with me when I listen to people. I get really involved in what they're talking about, and I forget my question.
I feel like yours would probably be pretty high.
Yeah, that's what it was. How much would it cost, or what would it be for me to come in and get tested?
Okay, just take the lab to any lab. Nothing.
Okay.
Yeah, it wouldn't cost anything.
Well, I want to go to a specialist. To me, going to a general practitioner, they don't know shit. They don't know anything about anything except like basic colds and.
I don't want to say that, but it's not their specialty.
Right.
Right. I mean, their specialty is other things.
Yeah.
And you have to know a lot about this. You have to have read a lot about it. I've been to, multiple courses, where you always pick up a few more little things, but they're not. That's not their thing.
Yeah.
You're not going to go to an orthopedic surgeon, because you're pregnant. I mean, that's not their thing.
Right.
So.
Yeah. So I believe in the specialist idea. I like
Right.
people like you. I like people like I deal with knees and hips. That's what I do. So
Right.
for me to go and visit somebody like you versus going to my doctor, when I asked, I think 3 or 4 years ago, could I get a testosterone test if we're going to do some blood tests? No, you don't need that. Well, I'm asking for it. Well, you don't really need it. I think how old are you? You blah blah blah. It's like they don't know, so they're going to bullshit you just to kind of throw you off. And I don't know anything about that.
They don't want to deal with that.
Yeah.
Number one, they don't want to deal with it, but they're kind of afraid of it because that's not what they do. What are they going to do if you get a low number? Now what are they going to do?
Right.
Well, they don't know what to do with it, so go see somebody else.
Well, usually they don't recommend anybody else. They just kind of fluff over the issue, and
they're very old school. So a lot of them are very old school. I mean, pellets and testosterone therapy. You will see a lot more of that in the future.
Yeah.
People will live longer. People will, do better when their levels are better. It kind of is the fountain of youth. I mean, it keeps you feeling better, but it makes all your organs better. Everything functions better.
Trying to think of any other things that might make me feel off. Does a vasectomy have anything to do with?
No.
Okay, because I know that just cuts the line off between the sperm and the semen. It just separates the two and cuts the one off. but I wondered if testosterone had any drop due to a vasectomy.
No, that shouldn't change it at all.
Shit, and that's probably the lack of sleep and the alcohol I drink, probably.
Well, alcohol's a big one, yeah, and lack of sleep is a big one. That is a big one.
Lack of sleep just affects every part of your body.
Oh yeah, it affects
life.
everything. Yeah.
I just think if I came in and saw you and you tested me, you'd say you don't need any TRT.
Well,
Because
you know,
your
it's
libido's just
it
fine.
depends on your functionality, right? So let's not, just because the number is good doesn't mean that you are good. So, if you came to me and said, hey, I feel pretty good and my libido's still great and, I'm getting around pretty good. Well, I mean, even if your number is a little bit low, do you really need to be treated? You're not symptomatic. So, you take both into consideration.
Okay.
So, I usually draw a fairly hard line at 500. So if you come in under 500 and you're symptomatic, you might benefit from it. Now, would everybody benefit? Well, maybe. There's a few people where you treat them and they just don't feel any different. But there's another side to the TRT too, where, if your numbers are lower, it's been shown in studies for decades that the incidence of other diseases have a bigger role on you if you are deficient in testosterone. For instance, type 2 diabetes. Most type 2 diabetics, if they were on testosterone, most of them can come off of their type 2 diabetic medicine. Most of them. There's a 50% decreased mortality from every other illness or disease if your testosterone levels are optimal. 50%. Wow. It's a huge number.
Wow.
Now, is that just due to maybe increased mitochondria, functionality in muscle, ways to process out the fats and everything that goes into your body?
Every organ performs better.
Really?
So everything. Bones are stronger. You have more muscle mass, less, visceral body fat. So the body's just functioning better. The pancreas is better. It helps. It's a very powerful anti-inflammatory. So people that have joint pains, that's one of the first things someone will tell me is, oh my God, all my joint pains are gone. Why? I don't know why. I'm like, well, because it's a very powerful anti-inflammatory.
Interesting.
It helps cardiac function. So 50% chance less of dying from a heart attack when your levels are normalized. So there's a lot less people that have psoriasis and other autoimmune diseases. It will make those a lot better.
Really?
People that have plaques, arterial plaques, where you hear, people got them in their carotids and in their heart. It can reverse the plaques that build up.
Interesting.
Because there's certain enzymes that are, so it goes way beyond feeling better.
Okay.
So it's not just about feeling, and that's a big part of it because everyone wants to feel better, but the other parts of it are far better. When you have a 50% chance less of dying from any other disease.
Yeah.
So
because everything's just functioning so much better.
Why isn't everybody on this?
Well, I say that's the thing. I feel like there's a stigmata, like, oh, you're taking TRT, oh, you're trying to get huge, or
Right. No, it's not about getting huge. It's about feeling better and being healthier, and that is it.
What about the aspect of athletes that are on TRT? I'm thinking of a UFC fighter, and specifically, his name is just lost it. But no, not that guy. Anyway, he was on it, and you could see it that he looked just very physically fit, like he was in his 20s.
Oh yeah.
And then the next
But he was
fight,
older?
yeah, he's probably late 30s, maybe early 40s, maybe even mid 40s. And the next fight, I think they told him he had to get off of it. We had to ban it because of X, Y, and Z. The next fight, he was very lean, very not as bulky. You could definitely tell a difference, definitely see a difference. So if the idea is to bring him up to his natural level, why wouldn't that be allowed in such a sporting type
I don't
arena?
know. That's a good question.
Yeah.
I mean, it's a medicine like any other medicine, and I don't know why they wouldn't allow an athlete to do. I mean, I guess they're saying it's kind of cheating, So you are what you are, and you perform where you're at, and everybody's on the same playing ground.
Okay.
So there's some of that, but yeah, there are. He would do a lot better if his levels were higher in the normal range. Everyone's going to do a lot better.
Okay.
So it's kind of an advantage. I guess that's how they look at it. But
Yeah, I think,
well, it is an advantage.
yeah,
I mean,
so
let's face it, it is.
Yeah. I say the younger guys are better because they're younger, and the
Right.
older you get, the slower you get a
Right,
little
the
bit.
slower you get.
Fast twitch slows down, and all that good stuff.
Right,
So,
and when you're in your 20s, we're all in a building phase, right? Your body's in an anabolic state, right? Everything's build. More muscle, faster, stronger. After your 20s, we're in a slow breakdown or catabolic state until we die, right? I mean, after that, starting in your 30s, everything's going to start coming down a little bit every year, and until we're dead, and that's nature's way of ensuring the survival of humanity. Because, if you think about other animals, like even cockroaches and flies, they turn around every 2 or 3 days. They'll live through anything. That ensures survivability of that species. So nature has to kill us off in order to make the next generation better.
Okay.
And the earlier we die, unfortunately, it's better the population of the world is going to be.
Sure.
So that's just nature's way of keeping it in balance.
But now everybody's trying to live longer, and we are living
Right.
longer. So that's just due to modern conveniences and things like that. But if we start supplementing testosterone, we all feel better. We get more productive, and
Right. Well, that's nature decreases our levels every year until our bones get brittle and organs break down, and that's it.
okay. So for like a 70-year-old woman who has low bone density, low muscle mass, and things like that, maybe some testosterone replacement therapy
They would do very well on it.
do very well.
Yes. Their bones will be stronger. They'll feel a little bit better. And it makes your skin glow. There's a lot of actors and actresses that they're almost all on some level of testosterone. Every single one. Everybody, the guy who trained me, a guy named Mark Richards out in Washington, D.C., he does everybody in the White House.
Oh, really?
Yeah. So everybody in the White House, or a lot of them anyway, are on it.
Okay.
Men and women.
So it's not the adrenochrome that everyone's been talking
No,
about.
it's not.
It's not baby fetuses and things like that.
No.
So just some names: Trimbolene, Anadrol, Cypionate, What? There's so many of them. Are they? Some of them are water soluble, some are fat soluble. Is
Right.
that how it works?
There are, there's like 15, 16 different kinds, but really the one that we really want is a testosterone cypionate. That's the one we want. It's oil-based, and it lasts longer. It has a long half-life. So you want something that lasts a long time. That's why the pellets are so great, because they'll last for 4 months. Testosterone cypionate, and there's an ethanate and a propionate, which have shorter half-lives. There's no benefit to a shorter half-life. It gets in your system and peaks faster. Well, so what? What's 2 days?
Right.
It's not that big a deal.
It's like a drug.
Right. You want
bump.
something that goes in and stays a long time, so you don't have to do it again for a long time. All those other ones, Deca and Trimbolene and all those other ones, those are for bodybuilding and for, those are, I don't deal with any of those.
No.
None of them.
I'd have to think most of them are probably not healthy for the regular population.
Oh no, those are the ones that'll get you in trouble. A lot of liver damage, blood pressure problems, cancers, things like that. So those are the ones you want to definitely stay away from.
What about all the over-the-counter crap like Nugenics?
None of it works.
Okay.
So it's a waste of time and money.
Even the stuff from GNC, they seem so
I know.
legit.
I know, they do. They even have, what is that guy, the big basketball player on the commercials for Nugenics? He's in the gym, and the girls are around him. Is that Shaquille O'Neal?
No, it's Frank Thomas. He used to be a baseball player.
Yeah.
Big,
I'm like,
big hurt.
this is
So what is
ridiculous.
Nugenics? I don't know.
It's like a supplement out of a can.
Yeah.
Or, just take it out of a plastic bottle. And
But they say it's
they
testosterone
advertise,
replacement?
but holds the bottle up. This will
Yeah.
get all the ladies, and then they'll
Right.
stop loving you. And
Testosterone has to be made. Your body has to make it. Drinking a can of whatever doesn't make you make anything,
Okay.
and it can't work.
So I think a lot of those things are like possibly FDA approved and whatnot. So how can they get away with selling them? And what effect is it bringing to people that are just thinking, oh my God, this shit works?
It's in their head.
Is it? Okay.
Placebo
So it's a
effect.
It's in their
placebo?
head.
All
Yeah,
right.
it's a placebo effect.
Interesting. I've tried a couple. I've tried something from GNC, and like I was telling you a while ago, that you open the bottle and the smell of maple syrup is so overwhelming. You want to take the two pills out of it and then put the cap back on. And shit, I couldn't tell any
Yeah,
difference. to be
yeah.
honest.
You won't tell any difference.
Yeah,
with
this was a while ago, and then, I didn't tell anything.
Yeah. I mean, it's all marketing and what the public perceives from their marketing. That's the way of the world.
Yeah.
With everything.
How long have you been doing this? Is this something that you started? Like,
We have been doing this since 2014 or 15.
okay.
Yeah. Now, I've known a lot about it in the prior years to that. I've known, I've done my research on it for years and years and years, but really didn't start offering it at our place until like 2014, 2015.
Okay. As you saw the benefit, someone talked to you into it or said, you've got to do this. I mean, people would just be lining up.
I had
for
a
benefit.
I had a friend of mine, she's in Cincinnati and she does a lot of it. And so I was talking with her and she's like, you can do this there too. So I, did my research, went to some courses and started doing it, and it's done really well. And I think, everybody, our patients love it. They will, once you usually start it, they do not want to come off of it.
Yeah.
Well, it sounds like it would just
yeah.
be awesome. I've got one friend he's just as old as I am and arthritic. He just feels pain all the time, and he started getting on the testosterone replacement therapy, and he's like, "Dude, I haven't felt this good in like 3 years."
Right. I mean, it gives people their life back.
Yeah.
That's how to think about it. When I, like I said, when I sit down with a conference, they're like, "I'm not the guy I used to be." That's like the beginning of the conversation. And then we go down the little ones. How's your libido? How's your energy? And how's your, and nobody wants to be the guy they used to be. Or they do want to be the guy they used to be.
Yeah.
They don't want to be the guy that's tired all the time and, can't be with his wife when he wants to be. And,
Right.
It's terrible. I mean, it's a miserable life.
Yeah. So especially if there's no energy and there's pain every day when you get up. I mean, it's a spiral. It's a mental spiral on you. And
I have one guy. I knew his wife for a long time, and so he would come in with his wife a lot. And he's a businessman. He always looked good, sharp, always looked great when he came in with his wife. And then one day, I didn't see her for a couple of years. He came in with her again, and he just looked emaciated and tired and dark circles around his eyes. And I'm like, I gotta ask, what's going on? You look great before. Now you look like you're half dead. And he got MS and was on medications from MS, and he was contemplating selling his business because he couldn't do any work anymore. He was too tired all the time. So we checked his levels, and his levels were about 400, which aren't terrible.
Yeah.
Which it's not terrible. But he could not survive on a 400. So we gave him the testosterone pellets. We bring him up to, he stays between 900 and 1,000, somewhere in there. And he is just a new person. He's like, I feel better than I did when I was 25.
Wow.
He's like, and I was going to sell my business because I couldn't keep anything up. Right. I had no energy. I was ready to just cash in on the world. And now he's like expanding his business. He feels better than he ever did. And he has MS. So there's, a lot of, I've seen people come in with bad psoriasis that it just disappears and doesn't come back while they're on it. It's really, there's a lot more to it than just, what people think. Oh, I just want to be, big and strong. No, that's a fraction of what it is. And that's not the fraction that I'm treating.
Right.
I'm treating the people to feel better and be better and healthier. And that's it.
Okay. So if the 400, 500 range is optimal, why would you put somebody closer to 1,000? What's the push to 1,000?
So
right around there anyway.
A lot of the studies show that anywhere between anything under 350 is considered a severe deficiency. Okay. Now, if you look at the numbers, you go get your testosterone check and look at the lab numbers, what the normal range is. The normal range goes from somewhere like 250 to 1,000. That's a big range.
Jesus.
That's not a little range, okay?
Yeah.
And why that range, or how that range is determined is taking the general population, everybody's testosterone numbers, average them all out to 1, and do 2 standard deviations, and that's the number they give. So the big problem with that is that 50 years ago, when there's something called EDCs, or endocrine disrupting chemicals, which is in plastics, food, and a lot more so over the last 50 years than 50 years ago. So on average, men and women, their testosterone levels were 50% higher than they are today for any given age. 50% higher.
Because
That's
of all
a
of that.
lot. That's a huge number. And because of all that, and then, you start reading, some people even, are predicting the future that, most of the population will be sterile by the 2050.
Yeah, I heard a lot about that. Yeah.
And that's a big prediction. I'm not sure that's going to come true. But all the chemicals and everything that we have in our foods and plastics, even in concrete, start affecting your hormone levels. So, again, let's go back to the testing. Well, the testing is where everybody is today with the 2 standard deviations. Well, that's 50% lower than 50 years ago. So you're already starting at this really low number.
Right.
And it has no, they need to look over time and see where people should be, instead of what the average 50% drop is. And now you're considered normal when you're nowhere near normal.
That's the feeling I got when I asked my doctor a couple years ago about getting a test on it.
Yeah.
And I think she
probably thought you were just in the normal range, and
just
nothing to worry about.
based on appearance alone,
Yeah. Well, and even if she does get the number, they get a number, say the range next to it says 250 to 1,000, which is a pretty big range.
Right.
And you're 251, you're normal. See you later. Oh, if you're having problems, here's Viagra. Go take that and you're all fine.
Right.
Or if you're got depression and anxiety, oh, here's some anxiety medicines, go take that. The problem is they're putting a Band-Aid on some of the little things when the real problem is, their anxiety or their, all these other issues are stemming from unhealthy behaviors, and they just don't feel good, and they've gained weight, and they don't look in the mirror and say, God, I look great, I look terrible, and they're depressed, and you got to treat the root cause.
Yeah.
Too many people just want to say, oh, well, you have libido issues, here's some Viagra, see you later.
Right.
That's not
They
the
just
problem.
want to treat the symptom
Right.
instead of.
Right. Or you have type 2 diabetes, here's the medicine. Well, the real reason is their levels aren't good, they've gained weight, they need to lose the weight, feel better, and then they can get rid of their diabetic medicine instead of just making the problem worse just by putting a Band-Aid on it.
Right.
So you think this could help with anxiety and depression too?
Oh, yeah. Yeah, most of my people will come off of most of those medicines. Not everybody, but most of them will. And especially the diabetics will do a lot better.
Wow.
Well, I'll say that you pretty much described me up to a certain level anyway. I wasn't so depressed that I was, oh God, woe is me. But it was a dark spot, and it happened about 4 years ago or so. And all of a sudden it was just like a crash. And that's when I went to see a doctor. Now all of a sudden I'm on anxiety meds.
Oh,
It's
yes.
where it could have been just, you need to really calculate your sleep or whatever it was, but it was just, the world just came crashing down all at one time. And I can't put exactly a finger on it to say this, that, and the other, but the fact that I was put on anxiety meds, I mean, granted they did help. And
Yeah, but they don't tell you when they put you on them that you're going to have a hell of a time getting off of them.
yeah, saying you've been on for how long?
18 years. Yeah.
And not everybody that has anxiety or depression, really needs that. It's putting a Band-Aid on. There might be something underlying that.
Yeah.
And sometimes it's just feeling better and looking better, and that's enough.
Yeah.
For most people, it is.
I'll say, if you get up in the morning, you look at yourself and say, oh God, well, no matter what I got going on today, at least I look good.
Yeah.
I don't not
Feel
this
good.
big slob, but I got in my head. I'm not in my head about it. I can look, oh good, well, at least I got that going for me. Or
If you feel good and look good everything else is easy.
Yeah.
Yeah.
Everything else, the whole world is easy then.
Let's say it quiets the monsters in your head.
Yeah.
It shuts
It does.
up, shuts the doubt out of your head.
Right.
At least I got this. At least my body can perform. If I know that I can't pull this bill down this week or whatever, then well, at least I got the energy to do all these other things. And
Correct.
I'll worry about that next time.
Well, yeah, just having extra energy alone. I mean, not being tired all the time and
Hmm.
waking up not being tired. That would be huge.
Let's say go to bed tired, to wake up tired. It's just like an endless cycle.
Vicious.
So, well, no, this has been interesting because I think there's always been a small stigmata associated with you're sticking needles in your ass. Well, why? Why are you
Right.
doing
Yeah.
that? You're not doing it for the right reasons. Well, you don't know anything about it. So I'm glad you were able to clear a lot of that
Yeah.
up
Yeah.
and explain some of the benefits.
Well, and 50 years ago, it wasn't as big a deal.
Right.
And everybody's levels were much better. But now with all the plasticizers and phthalates that are in all of our plastics and everything, now it is a big deal.
I say I've heard numerous things about the whole plastic thing. I heard that it actually shrinks the muscle between or underneath a man's scrotum. Like it actually shrinks muscles, and I don't think it shrinks the penis size or anything, but it's part of the process of sterilization and
Right.
or lower libido or something like that.
And it also can act as an estrogen too. So a lot of those endocrine disrupting chemicals can act like an estrogen and make your estrogens higher. And so we end up having to block a lot of people because of that. I see a fair amount of guys that come in and their estrogens are high, but their testosterone is low. And I'm like, that shouldn't be.
Yeah.
Well, there's only not too many reasons unless you have an estrogen producing tumor, which is possible. Usually the real reason is because of the EDCs in all of our food and everything.
That's just bonkers.
Yeah.
Is that why you haven't touched your bottle of water yet? Because it's in plastic bottle. So does that just basically come from every single piece of plastic? I mean, if we're drinking water out of
Everyone.
a plastic bottle, if we're cooking food inside a plastic Tupperware container, all those molecules, not all of them, but some are just leaching out into the food.
Yeah, there's trace amounts in almost everything these days.
Man.
That's the problem. And I don't think you're ever going to get away from it.
No, not today. No.
No.
Not unless you're walking around with glass or steel or aluminum, whatever. But
Yeah, there's the guy who trained me out in Washington, D.C., his name's Mark Richards. He has a book out, and I've read his book several times. So he literally wrote the book on it. This guy is that good. But, and when I have weird questions about people, I'll call him and say, hey, Mark, what do you think about this? But he has a book out. It's called, let's see, think of the name of it again. Why Nobody Wants You Healthy. And that's a great book. I have 100 of them in my office, so I just hand them out to people because he's really good. And in that book, he talks about the EDCs and goes through every organ system and goes through how it, you can cure a lot of chronic illnesses and decrease risk of death and morbidity and mortality, all from balancing hormone levels. It's a really, really, really good book. If you're ever interested in it, that is the book to read.
okay.
And it's easy reading. Probably
not-
read it in a couple hours.
Yeah, it's not all the Latin jargon. And,
No,
yeah.
not at all. It is. And if you read that book, you'll probably know more than most doctors do about hormones.
Wow.
Yeah.
That's good, but it's also bad. Just the reason it just adds to me not wanting to go see a regular doctor. If I feel like I've got something wrong with my eye, I go see that eye doctor. If I feel like I got something wrong with whatever, I'm going to go see that person, that specialist, because you go see somebody else, they're just like, well, I kind of read about it a little bit in college, and
Yeah. Well, the family doctor is the gatekeeper, and they do, when I think something's down, I think the right move is to see a family doctor, because it might not be that. It could be your thyroid's low, or, there's other reasons for not feeling well, but
for the most part, specialists are there.
yeah, and if they go in there and you're not feeling great and they run all their labs and they say everything's normal and you're not feeling great still, well, maybe there's something else going on.
Maybe I should have saw you 4 years ago. I still can go do that. But, I think
I learned a lot.
I say it's very interesting, and the cost, it always came down to the cost with me, and it's something I can't afford right now, but down the road, most likely to be something I leach into. Does it have, I've always measured this, you can tell me if this is crazy, just my head or what, but I've always thought when my testosterone starts to drop, because I've been a hairy son of a bitch ever since I was like seventh grade. So just legs are just covered with hair, right?
Mm-hmm.
So I've always said if my hair around my ankles and or my calves starts to patch, gets bald spots, and like I've seen a lot of older guys do, I'll use that as my measure of, I guess my testosterone's dropping.
That is one of our things on our questionnaire is hair loss, but I mean that's not a very good, not a very good guideline, I don't think.
No.
But
Okay.
yeah.
All right. Well, good to know.
I mean, really, you'll know it. I mean, most people will know it. They, you know, like I said, when they come in, they're like, I'm not the guy I used to be. That's really the key thing. You know, are you the guy you used to be? Well, if the answer is no, then it might be worth looking into.
Yeah, start taking it apart,
You know,
piece by piece.
Piece by piece.
Yeah.
And, you know, and the benefits, you know, reach far wider than bodybuilding and putting on muscle. That's not the reason why we do testosterone. That is the least reason. If someone comes in and says, hey, I just want to get bigger, then I just show them to the door and that's the end of it.
Right.
So we don't do it for, there's a very, you know, specific reason to do it. And there's, you know, to make people healthier and better. And that's it, not for bodybuilding.
Okay. So it sounds like everybody would benefit from it.
Everybody who, if you're symptomatic.
Well,
if
even,
you're symptomatic.
like I said, even the person that's 70-some years old, low bone density, low
right.
energy.
And some people, you know, when they get older, they'll come in and they're like, well, I'm just getting older, so I don't feel as good. My energy's gone. And I'm like, yeah, but not everybody is that way. So why are you that way? They just, I'm just getting older. Oh, my joints hurt. I'm just old. Well, I mean, that's not the case all the time.
Right.
You know, if you get their levels optimized, all of a sudden they're right back to where they were 20 years ago.
My God, if you didn't have to feel like that, that would be...
Well, and how many people hide behind that blanket of, well, I'm just getting older. Oh, it sucks getting old. You know, that shit.
Right.
I cannot stand that. It's like, yeah, I'm 43. 43. I never remember my age, but yeah, 43, and not saying I need to feel like I'm 20, but I know that I can, and I know that I want to.
Right. I
So
mean,
why wouldn't you want to feel that way? You can't just say, well, I've hit this age now. This is just what it feels like, so I'm told. So I'm just going to roll with it.
right, I'll just roll with it.
Yeah.
You don't have to roll with it.
Okay. Good to know. All good information.
And I mean, I honestly had no idea it was something women could do. So
that's
eye-opening.
Women, a lot of women will come in, well, because they're gaining weight, and you know that's a big one.
Yeah.
You know, they're trying to diet, but they're gaining weight. And if your testosterone levels are too low, there's nothing you can do about it. You cannot build. You know, you can't lose the weight because your hormones just won't let you. So no matter what you do, you're going to fail. And that puts them in depression, and that gives them anxiety.
It is so frustrating.
So you give them, you know, we give them a little bit of pellets, a little bit of testosterone. They feel better. They start losing the weight. You know, they're starting to have sex with their husband again, which they haven't had or they're, you know, they have to be drugged into the bedroom, and now they're willing. Now they want to have sex more than their husband does. And so a lot of times, if we do one person on either the male or the husband or the wife, the other one's going to come in at some point.
Yeah.
Because they can't keep up with their partner anymore. And it's, you know, we laugh about it, but it's a real problem. So I'll get a woman that comes in and she's like, my sex drive is 0. My husband is starting to look around. It's driving, you know, it's putting a big problem in our marriage. And all of a sudden we give her testosterone and she wants to have it more than he does. And he's like, I can't keep up with her anymore. He's like, this is great. He's like, this is the best thing I've ever seen.
Yeah.
And it'll save marriages. We've saved many marriages because of this. Many. You'd be surprised on how many.
And they actually tell you that.
They'll tell you that.
Yeah.
Yeah.
Wow.
It's fantastic. This sounds like the ultimate program.
Do you have payment plans?
Yeah, women do well when the premenopausal women don't do as well as the postmenopausal women. So, because when you're premenopausal, their hormones are all over the place.
Yeah.
Right.
Now, you know, there is some estrogen blockers you can do with the premenopausal women so they don't have big mood swings and big shifts. But the postmenopausal women, they tank all their hormones almost immediately. Yeah. And they go from, they go from pretty good to just feeling terrible and, tired all the time, and their libido is just gone overnight.
Yeah.
Those are the people that really do well.
Okay.
That really do well.
That makes sense. Completely makes sense. I didn't know how far off the levels dropped when they hit menopause, but
Although they go really. I mean, as a matter of fact, we'll get some of the test backs, and their testosterone level is undetectable.
Oh my gosh.
Yeah, so it's as close to zero as you can get, and you have to have it.
Okay.
Wow.
So what level do you bring a woman up to?
We usually somewhere between mid 200s to mid 300s.
Okay.
We don't like to go above that. If you're taking them into the 400 or 500s, then they will, they might start growing a little bit more facial hair. They wouldn't grow a beard, but they might see a few sprouts here and there. So you want to keep them, I like to try to keep them in the high 200s.
Okay.
That's where they perform very well.
Okay.
And they feel great. And it gets their libido, usually gets a lot better.
Cool. I'd say this sounds like a really good program, and it sounds like something that amazingly everybody would benefit from. And it's all monitored. It's all safe. It's all based on your own body chemistry. So,
in the book that I was talking to before, that Mark talks about, how and if you read the book, you'll understand, but how the drug companies, they do their testing on different medications. Testosterone is the worst thing for drug companies because they can't sell it, right? They can't patent it because it's testosterone. So they're selling their diabetic medicine, which makes them way more money.
sure.
Right.
But if those people were on testosterone for a lot cheaper that they can't, patent it or anything like that, then they just lost all that revenue. So, and he goes on to say that 75% of all the studies for those kinds of drugs are tainted. All of them.
Surprise. Big
Yeah.
surprise.
Yeah. And it's all to make money.
Oh, sure.
And when the cure could be optimizing their hormone levels and everybody does better, they don't need all these other medications, which is a lot more expensive.
Well, it's funny because you mentioned that, and I feel like I've been a proponent of the industry that used to prescribe diet and exercise will get you back to that fountain of youth. So, continue to take your medications, and we'll try to get you off of them by increasing your muscle mass and increasing your ability to, cycle through all these chemicals that you're putting in your body. But in reality, the women that I trained that were of a certain age, I couldn't help. Now hearing everything that you just said, there was no
Makes
way
sense.
that I could have given them the
You
hormones.
can't help them. Right.
By diet and exercise.
Right. It's just not possible. Their body just isn't making it. You can train them as hard as you want, but they're not going to get very far.
Fuck, I'm such a fraud.
No, I mean, you were definitely making them healthier, but
Sure.
you can't get them to the level you want to get them to.
Okay.
You just can't.
That's interesting. Man, that kind of bums me out. But at the same token, I still made them feel good, and they love their
Right.
workouts. And
And they're still
everything.
better for it.
Yeah.
And they're still better for it.
Totally makes sense. I mean, I work out 5 days a week. Now, when I try to eat healthy, I don't see a difference. So then I revert back to my unhealthy eating.
Right. They
And
get
it's just
frustrated.
it's just a vicious cycle. Why is this not doing anything? What is wrong with me? What am I doing wrong? But it's maybe not my fault.
Well, and the anxiety might not be your fault for
Yeah.
years. It could be you don't know where those levels are.
Right.
So yeah, we should both
At the
get
very
checked.
least, we need to get checked.
Yeah, so we should
I
both
think.
get checked.
Yeah.
All right, well, we're making an appointment to come over to see you. But with that, I thank you.
Yeah.
Thank you for
Yeah,
relaying all this
appreciate your
information.
time.
This is something I've been
Yeah.
wanting to hear more about.
And you'll probably see a lot more of it in the future. I mean, as it becomes more and more, for society is acceptable, then you will see a lot more of it. And people are going to live a lot longer and be better for it.
Okay. Yeah, I heard about the pellets probably 3 years ago.
Mm-hmm.
I was like, wow, that sounds really out there scientifically.
Right. It seems weird.
Okay.
Pellets.
Yeah.
What is that? Testosterone pellets?
Right.
Yeah, but it's they're bioidentical pellets. It's exactly what your body makes.
Mm-hmm.
It's not, it's not synthetic and like the Dianabol and all those other ones. Those are all synthetic steroids.
Okay.
These are not. These are bioidentical hormones. So your body doesn't know the difference between the two.
Interesting. All right. Well, Dr. Wade Banker, it's been a pleasure speaking with you.
Yes.
Can you
Thank
tell
you so
everybody again
much.
where they can find you?
Yeah, we are at 1500 Holland Road in Maumee, and our phone number is 419-893-2775. And so Lux Laser. Lux Laser.
Fantastic. Well, this has been really cool.
Yeah, yeah, and we're just touching the iceberg. You know,
Right.
we're just scratching on a fraction of some of the things. There's a lot of very cool things, and you know, and if you get that book, and if anyone's hearing this, I recommend that they get this book or come by my office and get the book, one of the two. But very powerful reading in that book, and you'll understand, you know, a lot about what I talked about.
Okay. Well, I'll be stopping by your office for that too. Expect to see me. All right. Well, thank you very much.
Yeah,
You're welcome.
Thank you.
Well, thank everybody for your time this time, and until next time.
Okay.
Thanks, everyone.